Hi, my name is Cynthia Posa, and I have chosen to speak about effective communication for this presentation. And the article that I've chosen to use to support this presentation is by Fiona Timmons from 2011. And the article's title is Manager's Duty to Maintain Good Workplace Communication Skills. Well, as far as the definition of communication goes, it primarily is really just taking a message and finding a way to transfer it to either an individual or groups. And with this being done, it truly does take special skills. Leadership is represented in our profession by example nurses or nurse managers, and they definitely require good communication skills because they're dealing with not only the public, but they're also dealing with their coworkers and individuals that are followers to them. So I will start off with explaining how they work towards developing interpersonal skills with others. And without the good communication skills, it really can damage how positive and productive the environment of the workplace and how it can be. Leaders have many different roles, and being a role model is one of their most important aspects. How they encourage their employees takes being able to speak effectively and present themselves with good communication skills. And to many, they think that it's just speaking, but there's a lot more to communication skills than just speaking with our mouths, our body language, our gestures, how we choose to take that path of communication, whether it be via emails or texting somebody or speaking one-on-one with them. Those leaders need to know which would be appropriate to use for them to successfully get their message across in a positive way or productive way also. It's not always going to be positive, but so that it's understood, that's the most important part. Important things to take into consideration with communication skills are self-awareness, conflict management, your attitude, voice tone, body gestures, timing, of course, and where they decide to have this communication in order for it to be effective, such as they just decide to do it in the middle of a nursing unit and it's a private conversation that should take place behind doors. That's not going to be very productive. In healthcare, our first priority is looking out for the safety of patients. Communication is huge when it comes to this because when we speak amongst each other, such as during report, we share a plan for our day of how we're going to carry out the care for the patients, such as when the nursing assistant and the nurse speak to one another and understand who's going to do what. Without this communication, a lot of work can be missed in caring for the patient. And when we do this communication, it's really important to consider not speaking in rank. A lot of the times if that happens, it can be very counterproductive and the opposite person may not even choose to listen. So it's good to not speak down to them, which stands for giving some kind of respect to the other person. And truly emphasizing the teamwork effort is to take care of the patient. When communication does not occur amongst coworkers and things do get missed, errors can be deadly. So it's very important to take this seriously. Instead of people taking the opportunity to communicate and choose to just assume what's going to occur and not speak to one another, this is when the assuming can lead to very problematic issues, such as medication errors, somebody giving a medication twice because they didn't speak to somebody else, such as even a charge nurse. They a lot of times will help each other or help the nursing staff, and if they choose to go give it and they didn't document it and another nurse went to give it, that can create possible fatalities. So it's important to speak to one another. How a leader, such as a charge nurse or manager, represents themselves can make a difference on how the entire staff responds with quality of work on a unit. I've been on units where people are afraid to speak to the nurse manager, and it's more of a closed door situation. And those floors were, the morale was very poor because the staff did not feel comfortable in approaching that nurse manager. So it's very important to give off that feel to the staff or followers that you are approachable, which does sometimes take some practice in possibly reflecting on your performance, possibly videotaping yourself or practicing in a mirror. But it's not something that comes natural for a lot of people, especially if they're in a higher rank position, to not just delegate, but delegate with authority. It's important not to be overly authoritative. Otherwise, people will be intimidated and not even take the opportunity to come and speak. And this can be very damaging to a leader, because a leader wants their staff or their followers to want to come to them, because a lot of times they have creative ideas and a leader cannot think of every idea. And once they have their staff feeling they're approachable, they add to the vision or the goals that the leader is trying to achieve. So it can be a much more productive outcome by the whole team putting their heads together and being creative instead of just the leader themselves. Next is having the ability to listen. Somebody can be approachable but not have good eye contact or let the other people know they're receptive to what they have to say. So it's very important to let others know that you're hearing them. You look eye to eye with them. You give them feedback, letting them know you heard what they said. That encourages and motivates others in wanting to communicate back to you, which is an important thing in communication skills, because a lot of people think it's more about the message you're trying to give off to others. But in communicating, listening is a big factor as well, because if you're not listening, you're not giving good feedback, because you're only partially knowing what the whole topic of the communication is even about. Also, as a leader, the next thing that is really important to consider is how they are as a role model. The staff, for example, they watch their managers, how they speak, how they carry out their work, and this designates how the mood is a lot of times on the units. So it's important, if you want a positive unit to communicate, you need to be a good role model as well for the followers. This gives them confidence, motivation, and a positive morale. Another situation requiring effective communication skills is working with multidisciplinary team members, and this is huge today, especially with computerized charting. A lot of the times the other team members who are working with patients, they don't necessarily come and get you. So documenting today is part of our communication, and so when we do so, it's really important to communicate with each other via this documentation, which lets us know what's going on with the patient so we can thoroughly care for them and make a plan and help to improve their care amongst each other. This helps to avoid duplicated work, and it also helps us to miss work that needs to be taken place with the patient. Keep in mind the differences when we are also communicating with the people or group that we're speaking to, because there are many differences to take into consideration. Sometimes it's their educational or cultural background. Some people have a college degree, some people don't. Some are in the medical area, some are secretarial. it's really important to know their background, because you might be speaking in terms that they have no idea what you're talking about, or culturally, you may be saying offensive things, and that pretty much turns the other person off from even listening to you. So, with that being said, be cautious in knowing the person you're speaking to a little bit before carrying on a conversation, because jargon can be very difficult with people in a professional environment, because you've got the technical aspect, the nursing aspect, and so forth. When we do this, that is showing respect for the people we are talking to, and you want to gain that in having good communication or interpersonal skills with another person. Lastly, language barriers. When you communicate with someone, it's very important to know that who you're speaking to doesn't have trouble understanding you, because language barriers are avoidable today, because we have machines that are in the hospital that are the two-way phones that can have a service to help be translators, and we also have cell phones that have translations on them. So keep that in mind when communicating, that if there is a language barrier, important information can be missed. In conclusion, as a leader, the most important thing is to remember there is a message we're trying to get to someone else or to another group, and if that message is important enough that you want to get it across to someone else, you have to find the right path, the right tone, and the right gestures in getting that message to the others. Thank you for listening.